Resistance to tyrants is obedience to God. It's Alex Jones.
I tell you, the news that I've been gathering over the last few weeks is extremely painful. I'm an American. I'm a father of 3 children. I live in Texas. I have family in Dallas. It's my hometown. And in the last, really 2 weeks, we talked to Dr. Edward Group, who was at a medical conference in Vegas, who talked to senior members of the Border Patrol and ICE who were there trying to find alternative treatments and ways to bolster the Border Patrol and ICE's immune system and for their families. And they brought up former deputy head of the Border Patrol and now the head of the retirees union, Zach Taylor. And they said that his intel was that indeed they had CDC vehicles on the border and were picking up people they believed had Ebola and were whisking them away to unknown facilities. Then I was contacted by a medical doctor who manages a very large hospital that has other hospitals outside of it. I'll leave it at that. Who lived in Austin previously, lives in another major Texas city. I'll just say this, it has a pro football team. In fact, I'm already saying too much. The point is, he said exactly what the gentleman is about to say right now. And I was sitting on this for a week, trying to talk to other medical doctors I know in major cities, and they wouldn't talk to me. They just said, what you're hearing is what we're hearing, and we've got what looks like confirmation of it, but don't you say you talk to me. I don't want to lose my license or worse. They are disappearing people. Now, that's exactly what senior members of the current Border Patrol told us, and we have those whistleblowers. We were directed by some of these sources, as you know, 3 months ago. The New York Times later picked it up and admitted it was true, to McAllen, Texas. Then we're going to our guest, where the Border Patrol was loading the illegals and their kids up on buses with vouchers into the rest of the country. So our sources are good. Now, we're joined by James Lawrenzi, and Dr. Lawrenzi works at the Cass Regional Medical Center in Garden City, Missouri, and he holds a D.O. and bachelor's degree in chemistry from Drury University and received his medical degree from Kansas City University of Medicine and Biosciences. He completed his internship and residency in family medicine at Truman Lakewood Medical Center and is affiliated with the Harrisonville Family Medicine, Inc., in addition to his practices in Archie Medical Clinic and Garden City Medical Clinic. Dr. Lawrenzi serves as the collaborating physician for nurses, practitioners, and it goes through all of that. He joins us. He's a doctor of osteopathic medicine, which is another branch of the MDs. And he's saying exactly what a major medical doctor that I know personally told me, shaking with fear a week ago. And this is why I have trouble even doing the broadcast, why I've been very upset around the office, is because we're trying to document all this, and as we document it, it's horrifying. Now, he's got to leave. He's got patients in 10 minutes, so we're going to go to him. He'll be back on in the next few days for a full hour. We want to encourage other medical doctors or medical workers to call in. We can vet who you are, either protect your identity, or if you want to go public, that's fine. There's strength and safety in numbers. James, doctor, you have amazing courage. Thank you for doing this. We said you didn't have to use your name. You proved who you were. You still have given us that intel. Thank you. Tell us exactly what you know and what you're being told.
So about 4 weeks ago, when this Ebola thing really started taking off here in the United States, and all of a sudden you started hearing about patients possibly having Ebola, the hospitals were beginning to test for it. Well, a friend of mine that's a resident at Truman Medical Center, which is where I did my residency at, called me and said, "Hey, we've got a possible Ebola patient here, and he's bleeding out of all of it. I'm not going to use the language he used, but he's bleeding out of all of his orifices. He's in septic shock, hypotensive, high fever. He was visiting Africa, or he was from Africa, I believe, and had recently been here in the Kansas City area. And excuse me, they took care of him in the ICU. Of course, it was not a rapid test, so they weren't sure, but I think they ordered the test and they sent it off, and they moved him to the ICU and they put him in isolation, from what my friend had told me. The following day, he called me back, and because I told him to let me know, because I wanted to call your show. I wanted to let people know that, hey, we've got a case here in Kansas City. Well, he called me back the next day and said they disappeared the patient. I said, what do you mean they disappeared him? He said, the patient's gone. They were told that he left AMA, which means against medical advice, but the guy he wouldn't have been able to leave. I mean, he was in that bad of a shape. I said, well, look for John Doe, which is the name that they use in hospitals in case, that somebody's admitted that they don't know who you are. And there was no John Does in the hospital, so the patient disappeared. Well, the following day, they had a meeting with anybody that had contact with that patient, and said that he didn't have Ebola, he had malaria. Well, all of a sudden, that's when we heard that all these other cases in these other cities, they were coming back and saying, no, they didn't have Ebola, they had malaria. That seemed like that was that's what they were told to tell everybody. Well, then we had a second patient at Research Medical Center that was rumored to have, because I have friends there too, and they called me and said, we have a possible Ebola patient. That patient disappeared. There's a patient more recently at KU Medical Center, which is just down just across on the Kansas side, about 20 minutes from here. And that patient, I don't know what the status of that patient is, but they came out and said that he didn't have Ebola, but he had typhoid. So something very, very strange is going on. And I wouldn't have thought much about it, but this is happening in other areas of the country, not only in Kansas City. These patients are disappearing. They're doing something on the patients, and God knows where they're going.
Well, we have flights into Houston, flights into New York from Nigeria. That's the country the Ebola people are getting into to fly out. That's the major airline hub. They come from other African nations in most cases. They die vomiting on airplanes, or they're found dead in pools of blood and vomit and feces, not to get too detailed here, in Houston. And they're just told instantly Ebola ruled out before they even get the dead body off the plane in the case of JFK. But the telltale sign is the medical people don't want to be around it. The folks cleaning up the airplanes are on strike. They're scared, saying there's vomit all over the place. It looks like there is a flood of refugees, medical refugees, out of West Africa here because other African countries won't let them in. I mean, undoubtedly, if 2 nurses got Ebola from patient 0, and then now they say it's all stopped, when this guy was running around for a week and a half vomiting everywhere, doctor, does that make any sense to you? I mean, what you're saying and what others are telling us is this is happening in Dallas, you name it, the same thing. They come in, they disappear them. We have it from the Border Patrol that the same thing's going on. Do you think they're trying to cover this up so there won't be a panic? If they were doing that, why would they then not stop the flights? I mean, it'd be one thing if they were disappearing people to Army bases, which they were supposed to begin with, is just publicly take them there, where they're level 4, that's the default. But then why would they still let them come in and then let people that have it spread it? And why would the CDC tell a nurse that treated an Ebola patient, hey, I have a fever, is it okay if I fly to visit family? And they tell her yes. What does this sound like to you?
Well, there's several different scenarios. I mean, either they're deliberately trying to cause this to spread, number one. Number two, they don't want to cause a panic. And there's hundreds or thousands of people that already have it. And it's just a matter of time before that people become aware of this, and they're trying to delay it as much as possible so they can get ready to try to deal with the panic. Or it absolutely makes no sense. And we're told at our hospital that if we have a suspected Ebola patient, to not use the word Ebola, not to just say they have some type of viral illness, put them in isolation, but not to use that terminology with they're threatening people that you'll be fired, you'll up.
Dr. Lawrenzi, stay there. That is bombshell. That just clicked. They've been ordered in major cities 2 weeks ago on the police networks. In New York, the firefighters and others have been told, do not use the word Ebola, use code words. And there's the Daily Mail headline for TV viewers. So clearly we know there's a cover-up going on. That's key proof right there. That is amazing. So you specifically and others have been told, do not let people know if there's an Ebola case?
That's or a possible Ebola case, absolutely.
Okay, please go to your next point. Excuse me.
Well, another interesting thing that I found out from several nurses and from drug reps that come to our hospital, to my office, they have contact with various people around the city. And HCA, which is one of the big hospital companies that own a lot of hospitals in the country, they own several in Kansas City. They went 3 days ago now. They went and they took all of the gear, the protective equipment away from all the different departments without replacing it with anything. They took the N95 masks. They took their whatever crappy equipment they had. It was better than nothing, but they took it all. They have not replaced it with anything. They were told that this is so they could have continuity of care for the possible Ebola patients. They just went through all the hospitals and they've taken it. I don't know if they've done it. HCA owns hospitals all around the country, so I don't know if it's going on in other cities or not. It'd be interesting to find out.
You are just dropping bombshell after bombshell. So it's fair. We'll just basically have no protection or just wear a mask. That is amazing.
And I think they're doing it because they don't want to cause a panic. They know something that we don't know yet, and it's a matter of time before.
So they don't want people in spacesuits at hospitals, even though it'll protect them, because that would cause a panic. It's all about the image. It's all about the optics.
Right. And we were told, like, I run 2 rural clinics outside of the hospital in Archie and Garden City, like you mentioned. The infectious disease nurse sent out these stupid little packets that contain an N95 mask, some booties, gloves, and a gown, and told us that if we have a suspected Ebola case, put this on. And they told the office staff to ask, this is the screening process now that we're told to do, ask them if they've traveled anywhere. And I said, okay, well, if they have, if they've traveled they came back from Africa, then what? Well, we don't know. Just ask them. And that's the screening process that we're told to do at this point in time. It's ridiculous. It's a joke. Yeah,
that's like telling somebody they can jump out of an airplane at 10,000 feet with an umbrella as a parachute.
Well, I mean, the reason I'm coming on here is I'm hoping to find out from other physicians around the country or medical personnel, is this going on, is it just here? Is it just our hospital? Is it Kansas City? Or is this going on everywhere? I think I already know the answer to this, but it's time to not be afraid. I mean, it's a piece of paper. It's a medical license. I mean, if they pull my license for this, so be it. I mean, we need to get this information out. This is serious.
Well, that's right. I mean, they used to tell radio stations, don't criticize the president or the FCC might take your license. What is this, Soviet Russia? What happened to the First Amendment? And you shouldn't have to be part of a criminal conspiracy to cover up Ebola and lie to people. That you should get an award for doing the right thing, not be penalized. But the right thing to do is the right thing to do, and there's strength in numbers. We need more people, as you said, to call in here. In fact, we have a guest coming up, and he's a very important guest on the economy front, Harry Dent. I am tempted to try to move him to 12:30 or move him to another day just because I need to open the phones up. Specifically, this is such huge news. It's even bigger than the economy because this will tank the economy if we don't get the word out on it. But Dr. James Lawrenzi, thank you for your courage. Specifically, why do you think the other medical doctors we're talking to are scared to give their names and are saying they think they'll get their medical license pulled? I mean, what's a medical license worth if there's a pandemic and people lose their family to this? I mean, this attitude of doing whatever the feds say is going to kill this country. This is insanity.
It doesn't make any sense. I'm not afraid of doing the right thing. I think it's a cop-out. Either they're afraid of maybe their employers, maybe losing their job, causing up a stir. To me, it makes no sense. There's no other option than doing something like this to wake people up. It's the right thing to do. That's why we went into medicine, to help people. it's become so bureaucratic. You know, there's so much bureaucracy now in medicine, and I don't know. I can't answer why they're not coming out. It makes no sense to me.
Well, you're near a major city, and so that's why you're also seeing in a lot of smaller towns or regions that aren't in the major thoroughfares probably haven't seen this hit yet. In the few minutes we've got left with you, Doctor, I want to get you back again tonight on the Nightly News if you can, or tomorrow for another update, and then obviously Sunday. But we are having a bunch of whistleblowers contact us in government, you name it, including Ebola screeners at airports. It's just we have to process all that investigative material as well. So it's important for people to continue to blow the whistle and to blow the whistle to others, because I think a lot of this is just ignorance. But we do need whistleblowers to call in. We didn't need them to confirm or deny this or give us more intel. The problem is I've already confirmed what you're saying from folks in Texas. Anything else you'd like to add out there for listeners?
Just be aware, be careful, stay away from places where there's large groups of people. I really think this is much more serious than they're letting on, whether this is really Ebola or something else. Something is going on. They're preparing for something, and I think they're delaying the information coming out as long as possible, because they're putting whatever system they're trying to put into place for whether it's the martial law situation or if they're going to, you know, because some of those executive orders Obama signed takes over all medical personnel, and I don't know if they're trying to get that set up. I don't know. It's just keep your eyes and ears open and stay out of hospitals if you can. That's the worst place in the world to be right now, especially flu season coming around. It's going to be a nightmare. When flu season hits, people are going to be coming to the hospital for flu or Ebola, or they don't know what they have, and you know, going to be around a bunch of other people. It's going to be a nightmare. And every doctor that I've spoken with is terrified of this fall. And
let me ask you this. We're going to skip this network break. I know you've got to go in just a few minutes, but I want to keep you as long as we can. Tell me when you've got to go. The other key question, what do the other medical doctors, what do the nurses, what do they think is going on? Is it a state of concern, a state of not caring, a state of panic, of quiet panic? What's going on?
Well, a lot of them come up to me, and I say, well, I'll let you know when it's time to panic. But they are very, very concerned, and they've several nurses and other personnel, as I've spoken with their families, and come up to me and said, hey, if we have an Ebola case, I'm not coming to work. I'm staying home. I'm taking care of my family. And
well, especially when you don't have the right gear.
Correct. That's correct. There's been no training at the hospital. There's been no, and I call the infectious disease nurse and said, listen, we need to practice this scenario. We need to know where to go. Where's the gear at? Oh, we've got it covered. Don't worry about it. And they don't. And everybody's freaking out. It's like nobody knows what to do. So there is a sense of panic that's slowly occurring, at least at our hospital. I can't speak for the other hospital. But the drug reps are actually, I'm getting a lot of information from them because they go around. We see the same reps all the time and kind of develop a personal relationship with them. And they go around and talk to other doctors, and they're telling me the same thing. It's like that's all they're talking about. That's all patients are asking about. They're coming in and asking, Doc, what do we do? I say, I don't know. Get some colloidal silver. That's the only thing I know that's going to help you. And get some N95 masks and stay away from public places. But people are very concerned about it.
So in your medical opinion, you think there's some evidence showing that colloidal silver is a good alternative antibiotic?
Absolutely, because I actually have a generator that I purchased from. I won't name where I got it from, but I spoke with the guy that made it, and he's got some information. And there's actually a U.S. Army study that I pulled that shows that it does kill Ebola. They tested it back in, I think it was in the 80s. That anybody can search for it and find it. Colloidal silver does kill Ebola. It kills as well as the flu virus and any other viruses that may be lurking
Well, sure,
around.
silver's always been known. I mean, sunlight kills it, too. The question is, can it get in there? I mean, I don't think we can say, from my view, but I'm not a medical doctor like you, it certainly, it can be an alternative treatment, has a lot of promising things that it's shown. And I know government itself has been buying heavily into it while demonizing anybody that tries to talk about any alternative treatment. I mean, it was well known back during the Black Plague that lots of garlic and vitamin C, they didn't know what vitamin C was, but fruit helped people, not get it because it boosted their immune system. And that's all we're here talking about is obviously staying away from airports if you can, staying away from international hubs, and quite frankly, West Africans coming off airplanes. That's a no-brainer when they're set to have 1 million+ cases over there. And it's just absolutely vital that we all be vigilant. And I think get the word out here, because if there is a concern, not a panic, then they'll shut down the flights. Because if Ebola isn't exponentially spreading, Doc, if more flights pour in, and the World Health Organization estimates that more Ebola flights will end up getting into Western countries, why then, if they admit that, would they allow that to continue with something that kills 70% of people? What's your view on that?
Because it's going to prove that his open border policy is a failure and contributing to this, and you can directly correlate that to Obama's policy, and he would truly be, Ebola, as we like to call him now. I think that's the main reason. And the only alternative is that they want people to get infected. They need this to occur. This is their next big crisis. Don't let a crisis go to waste type of a scenario. And the CDC can play with their toys. They can go out and they can implement the protocols. They can get their airtime. They can be the saviors of the country. But by then it's going to be too late, I think.
Dr. James Lawrenzi, thank you so much. We're going to give you my cell phone number as you leave here. Please give it to him, guys. We're going to give you Anthony Gucciardi's cell, Nico Acosta's cell, so that you can get in contact with us, because we've had other whistleblowers before that had some pretty serious repercussions. The fact that we're talking to you openly, though, the fact that you put your name out, I think protects you to a great extent. In my experience, it's folks that don't give their name. They use the NSA to figure out who was on and then threaten them. I think the fact that what you're doing is so moral, and most people, even in the government, agree with you. We should all say a prayer for you, a prayer for this nation. But as Mark Twain said in the beginning, a patriot's a scarce man, hated, feared, and scorned. But in time when his cause succeeds, the timid join him, because then it costs nothing to be a patriot. Thank you for what you've done for my family. Thank you for what you've done for all of us and your courage, because we know a lot of Border Patrol people, a lot of medical people who are saying the exact same thing, including people that have seen it happen in their hospital in a major Texas city, and they're scared to come on. And I'm glad they even called me. That took more courage. But you are the equivalent in the Infowars of our Audie Murphy coming on here, sir. So just God bless you, doctor.
Well, thank you very much, and keep up the great work. I really enjoy what you do. God bless you.
God bless you. Well, we're all in this together. I went and saw last night Fury with Brad Pitt, and I knew a lot of World War II Sherman tankers who I hunted with when I was a kid. They're all dead now. And I'd always try to get them to tell me war stories, and they'd say, "Kid, imagine a beautiful blonde that looks like Marilyn Monroe walks up with a trench coat, opens it up, and starts shooting at you with a machine gun, and you cut her in half. Now, let's go hunting, but don't ask me any more war stories." And so the movie's very accurate from a lot of the reports I've gotten and things, and what it was like over there. And the story is Audie Murphy, through North Africa, into Italy, into Germany. And the character is Audie Murphy. And the reason I'm talking about this is that was a real Audie Murphy we just talked to in the Infowars. It takes more courage historically to do something that's not even military when you're being backed and told it's okay than to do something against the grain in your own country. And they ripped off Audie Murphy. It's the story of Audie Murphy, except it was one guy killing 300 people at a crossroads against a bunch of SS and Germans and half-tracks. It was Audie Murphy, and he didn't get killed. And it's just, that's how screwed up Hollywood is that it looks like Audie Murphy. Audie Murphy looked like Brad Pitt, or he looks like him. It is Audie Murphy. And they don't give him credit. It's sick. And they've got him getting killed at the end. Everything's twisted. I mean, they should at least say some of this is based on Audie Murphy, but I didn't see that. And I don't know why I just digressed off into that. It's just that we need people that have the moral courage to stand up for this country now or lose everything. Where are the men out there? Well, we just talked to one of them, Dr. James Lawrenzi. And he's like thanking me for what I do. Hey, we're trying to self-preserve here. We're trying to do the same thing. I don't deserve to be thanked. This is what I do. This is what I said I wanted to do. Said I wanted to fight tyranny. I wanted the truth, the whole truth. I pray to God every day to sanctify me, to lead God and direct me, because I am a wicked devil. And that I be used as a vessel. I've tried to turn myself over to God. And this is what I was born to do. And I know you were born to do this as well. But I'll tell you, folks, we shouldn't be thanked for what we're doing. We should be thanking God for giving us the guidance, because this is the time to call on God. We'll be back. Stay with us.